Hello, I'm Dr. Selena. Today, I'm going to tell you this: when you open your mouth and look in the mirror right now, you might be living with one of the most common diseases in your body without even realizing it. Yes, you heard that right. According to World Health Organization data, approximately 90% of the world's population experiences tooth decay in their lifetime. This makes it the second most common disease in the world, after the common cold. So, 9 out of 10 people watching this video right now have or will have a problem with their teeth. Am I saying this to scare you? No, to raise awareness. Because knowledge is power, and having accurate information about tooth decay is the first step to defeating it. What if I told you that this tiny, initially harmless white spot can lead to infection, abscesses, and even heart disease if left untreated? Yes, you heard that right, a decayed tooth can cause a heart infection, which can be fatal. Today, we'll listen to the story of this invisible enemy, dating from prehistoric times to the present day. You'll learn how tooth decay occurs, what symptoms to watch out for, what treatments are available, and most importantly, what you can do at home. We'll even discuss some celebrities' dental problems, because after all, they're human, just like us, and their teeth decay too. So, if you're ready, let's dive into the dark yet enlightening world of tooth decay. Part 1: What is tooth cavity and what makes it happen? So, what exactly is tooth decay? Simply put, tooth decay is tiny holes formed when bacteria and acids erode tooth enamel. But it's not that simple, of course. I'll tell you the science behind it now, but don't worry, it won't be boring. You have billions of bacteria living in your mouth right now. Yes, billions. Most of them are harmless, and some are even beneficial. But there are some that are malicious. When you eat foods containing sugar and starch, these bacteria metabolize them and produce acids. This is where the problem begins. These acids attack your tooth enamel. While tooth enamel is the hardest substance in your body, it weakens over time under the constant acid attack. We call this process demineralization. This means your minerals are lost. Initially, this appears as whitish spots on the tooth, no holes yet, but the damage has already begun. If you don't intervene at this stage, the enamel will completely deteriorate, and decay will occur. The decay can progress to the deeper layers of the tooth, the dentin and even the pulp, the nerve of the tooth. And that's when the real problems begin. The data from Türkiye is quite striking. 81 to 84% of children aged 12 to 13 have cavities. In the 30 to 34 age group, only 3 out of 100 people are cavities-free. These aren't just statistics, they're our reality. And this reality tells us, we don't pay enough attention to oral hygiene. Part 2: The 5 stages of tooth decay. Tooth decay doesn't occur overnight. It progresses through 5 distinct stages, and you'll notice different symptoms at each stage. Let's examine them one by one. Stage 1: Demineralization. This is the earliest stage. Whitish, dull spots appear on the tooth. This indicates that the minerals in the enamel have begun to break down. The good news? At this stage, decay is reversible. With fluoride treatment and good oral hygiene, you can save your tooth. Stage 2: Enamel decay. The white spots begin to turn brown. Visible cavities form in the enamel. While irreversible, treatment is still simple, a simple filling is all it takes. Stage 3: Dentin decay. The decay has reached the dentin layer beneath the enamel. Cavity formation increases rapidly. Sensitivity to hot, cold, and sweet foods begins. The spots become darker. At this stage, you should definitely see your dentist. Stage 4: Pulp damage. The decay has reached the innermost part of the tooth, the pulp, which contains nerves and blood vessels. Severe pain begins, disrupting your sleep. Root canal treatment is usually necessary at this stage. Stage 5: Abscess formation. This is the most dangerous stage. The tooth has become infected, and an abscess, a pus-filled sac, has formed. The pain isn't confined to the tooth, it radiates to the jaw and neck. Lymph nodes swell. A fever may even occur. In rare cases, this infection can spread to the bloodstream and cause sepsis, a life-threatening condition. Part 3, Symptoms to watch out for. The symptoms of tooth decay are sometimes so subtle that it may be too late by the time you notice them. However, if you see these symptoms, you should take action immediately. Sensitivity to hot, cold, or sweet foods. Do you feel a sharp sting in your teeth when you take a sip of cold water? This is an early warning sign. Spots visible on the teeth, white, brown, or black spots. These aren't just cosmetic issues, they're indicators of decay. Pain when biting or chewing. If you feel pain even when eating bread, the decay may be advanced. A visible hole or pit on the tooth. If you feel a gap when you feel your tooth with your tongue, don't waste time. Persistent bad breath. Decayed teeth are a source of bad breath. No amount of mouthwash or chewing gum can permanently eliminate this odor. Swelling and redness around the gums. The infection may have spread to the gum tissue. Severe and persistent toothache, a throbbing pain that worsens especially at night. This is a sign that the toothache is advanced. An interesting fact, some patients with advanced toothaches can even remember the exact moment the toothache began. Many people may say, "It started at this exact time, in this exact place." This was a distinguishing feature from other illnesses like the flu. Doctors used it before tests became widely available. Part 4, Dental Decay from History to Today. Now let's take you on a journey through time. Tooth decay isn't a new disease, it's as old as human history itself. According to archaeologists, evidence has been found of tooth decay treatment in a person who lived 14,000 years ago. This skeleton, found in Italy, had a hole in its tooth made with tools like flint. Yes, even 14,000 years ago, people were still trying to relieve toothaches. The ancient Egyptians placed great importance on dentistry. The first known dentist, Hesiri, lived in 2660 BC. Egyptians treated tooth abscesses by draining them and even built primitive bridges. But the most intriguing theory was the toothworm theory. From 5000 BC until the 18th century, people believed that tooth decay was caused by tiny worms living inside the teeth. A cure? Trying to kill the worms by chewing hot peppers. The Aztecs used this method. In 1728, French dentist Pierre Fauchard became known as the father of modern dentistry. He was the first to challenge the toothworm theory, arguing that bacteria were the primary cause of tooth decay. So why is tooth decay so common today? The answer, sugar. Tooth decay was quite rare in prehistoric humans, around 3%, according to research. This rate increased when agriculture began in the Neolithic era and people began consuming grains. But the real boom came with the cultivation of sugarcane and the widespread availability of sugar, especially after the 18th century. The average person today consumes more sugar per day than a prehistoric person did in a year. That's the root of the problem. Chapter 5, Tooth Decay Statistics in the World and Türkiye. Now let's talk about the numbers. Because sometimes, numbers are the most effective tool in showing the seriousness of reality. According to the World Health Organization, 90% of the world's population is at risk from tooth decay and gum disease. That's billions of people. Tooth decay is the second most common disease in the world, after the common cold. In the US, it's 5 times more common than asthma in children. The situation in Türkiye is even more striking. Only 17% of 6-year-olds are cavities-free. 81 to 84 out of every 100 children in the 12 to 13 age group have cavities. 97 out of every 100 people in the 30 to 34 age group have cavities. The average number of teeth requiring treatment per person in the 20 to 24 age group is 5.48. 47% of our population has not visited a dentist in the past year. Even more troubling, 12.5% of the population has never visited a dentist in their lifetime. The number of toothbrushes per person is 0.94. This means more than half of the population does not even have a regularly used toothbrush. Tooth decay affects not only oral health but also overall health. According to research, individuals with poor oral hygiene are 4 to 5 times more likely to develop chronic respiratory disease. Those aged 39 to 69 with tooth and gum disease have a 3 to 7 times higher risk of heart disease. Pregnant women with severe gum disease have an 8 times higher risk of having a low birth weight baby. You see, tooth decay isn't just a problem for your teeth, it affects your entire body. Chapter 6: Celebrities and Tooth Decay. Now, let's lighten up a bit and delve into the world of celebrities. Because dental problems don't just happen to ordinary people, they happen to celebrities too. Tom Cruise had crooked and discolored teeth in his youth. The flawless smile we see today is the result of professional dental treatment. Scarlett Johansson had cavities repaired and had veneers applied. Queen Elizabeth I was known as the candy addict of her time. Her teeth were so bad that she used to cover the gaps with cloth when she went out in public. French King Louis XIV's jaw broke during the extraction of his upper molar, resulting in an infection. The king was forced to spend the rest of his life without his upper teeth. Even a king couldn't escape dental problems. It's said that George Washington had wooden teeth, but that's a myth. In reality, his dentures were made of bone, hippo tusks, ivory, human teeth, brass screws, and gold. They were incredibly uncomfortable. Looking at today's celebrities, many local celebrities, such as Burhan Sat, Kivanch Tatlatug, Tarkan, and Seda Sayan, have undergone cosmetic dental procedures and treatments. Among foreign celebrities, Justin Bieber, Taylor Swift, Miley Cyrus, Cardi B, and Cristiano Ronaldo have also undergone dental treatment. The message is, whether you're rich or famous, you can't avoid tooth decay. But you can prevent and treat it. Chapter 7: Treatment Methods. So how is tooth decay treated? Treatment depends on the stage of the decay. 1. Fluoride treatment. In the earliest stages of decay, when only white spots are present, fluoride treatment can be applied. Fluoride strengthens tooth enamel and promotes remineralization. It can be applied in liquid, gel, foam, or varnish forms. 2. Filling treatment, the most common treatment method. The decayed area is cleaned, and then the cavity is filled with filling materials such as composite, amalgam, or glass ionomer. Composite fillings are preferred for their aesthetic appeal because they are tooth-colored. 3. Root canal treatment. If the decay has reached the pulp, that is, if it has reached the nerve, a root canal treatment is necessary. The nerves and blood vessels inside the tooth are cleaned, the canal is sterilized and filled, and a crown is placed over it. 4. Crowns. If the decay is extensive and a large portion of the tooth is damaged, a full crown is placed after the tooth is cleaned. A crown both protects the tooth and restores its function. 5. Tooth extraction. If unfortunately, the tooth cannot be saved, it must be extracted. Then, an implant or bridge is placed to fill the space. But remember, tooth decay will not go away on its own without treatment. Because tooth enamel does not contain living cells, it cannot repair itself. Professional intervention is absolutely necessary. Part 8: Natural home treatment methods and pain relief. You might be asking, Dr. Selena, what can I do at home? First of all, I must say this: home remedies are definitely not a substitute for a visit to the dentist. They only provide temporary pain relief. But until you see a dentist, you can try the following. 1. Salt water gargle, the most effective natural method. Mix a teaspoon of salt in a glass of warm water. Gargle 3 to 4 times a day. Salt water is a natural antiseptic, cleansing bacteria and reducing inflammation. 2. Cold compress. Apply cold compress to the outside of the cheek for 15 to 20 minutes. It reduces swelling and relieves pain. 3. Clove oil has natural pain-relieving properties. Put a drop of it on a piece of cotton and apply it to the aching tooth. However, be careful, as using too much can cause gum sensitivity. 4. Peppermint tea. Peppermint contains menthol and has antibacterial properties. You can apply a chilled peppermint bag to the affected area. 5. Garlic, a natural antibiotic. Crush a clove of garlic and apply it to the affected area. The smell is unpleasant but effective. 6. Thyme oil. Add 1 to 2 drops of thyme oil to a glass of water and gargle. Or, apply it to a cotton ball and apply it to the tooth. 7. Hydrogen peroxide. Mix 3% hydrogen peroxide with equal parts water and gargle. It kills bacteria, but don't swallow. Painkillers, you can take paracetamol, Parol, Minocet, or ibuprofen, Apronax, Arvels. But these are only temporary solutions. They won't solve the underlying problem. Be careful during pregnancy. Dental treatments should be postponed as much as possible during pregnancy. In this case, the natural methods mentioned above are even more important. However, be sure to consult your dentist. Chapter 9, Prevention Methods. The best treatment is prevention. Now we come to the most important part: how do we prevent tooth decay? 1. Regular teeth brushing. Brush your teeth for at least 2 minutes at least twice a day, after breakfast and before bed at night. Use fluoride toothpaste. 2. Flossing. A toothbrush cannot remove plaque between your teeth. Be sure to floss once a day. 3. Mouthwash. You can use a fluoride mouthwash, but don't overdo it. Frequent use can damage the oral flora. 4. Brush your tongue. Harmful bacteria accumulate not only on your teeth but also on your tongue. Use a tongue brush or spoon. 5. Reduce sugar consumption. This is the most important step. Sugary drinks, sweets, and candies are the biggest enemies of tooth decay. Avoid sticky, sugary foods, chocolate, candy, caramel. 6. Avoid acidic beverages. Cola, soda, energy drinks, and fruit juices erode tooth enamel. If you have, wait half an hour before brushing your teeth. 7. Consume protective foods. Calcium-containing foods like cheese, yogurt, and milk strengthen teeth. Firm, fibrous foods like apples, carrots, and celery clean teeth. Green tea contains antioxidants and prevents bacterial growth. 8. Drink plenty of water. Water prevents dry mouth and flushes bacteria. Rinse your mouth with water, especially after eating something sugary. 9. Chew gum. Sugar-free gum increases saliva production. Saliva is a natural protector. 10. Regular dental checkups. See your dentist at least twice a year. Early diagnosis saves lives. Unfortunately, the frequency of dentist visits is very low in Türkiye. In developed countries, the population visits the dentist an average of 5 times a year, while in our country, this number is only 0.7. That's 7 times in 10 years. This is insufficient. Chapter 10, Things to Never Do. There are some critical mistakes to avoid when it comes to tooth decay. 1. Not going to the dentist just because the pain is gone. Sometimes the decay kills the nerve and the pain goes away. But this doesn't mean the problem is gone. The infection continues to grow internally. 2. Trying to get away with taking antibiotics. Antibiotics may temporarily suppress the infection, but they don't cure the decay. 3. Neglecting a decayed tooth, saying, "It's just a tooth, let it fall out." No. Every tooth is important. Every lost tooth causes the jawbone to recede. 4. Delaying treatment completely during pregnancy. There are emergencies. Dental treatments are safe in the second trimester of pregnancy. 5. Brushing too hard. Tooth enamel and gums are damaged. Brush gently. 6. Brushing immediately after meals. Wait 30 minutes, especially if you've consumed acidic foods or drinks. Otherwise, you could damage the enamel more than you can. 7. Putting an aspirin on a decayed tooth. This is an old method, but the acid damages the enamel. Take the aspirin internally, not on the tooth. 8. Trying online treatments. Don't believe videos like "Treat your tooth decay at home in 2 days." It's impossible. Conclusion. There you have it, friends. We've discussed everything you need to know about tooth decay. Let's summarize. Tooth decay is a preventable but serious disease that affects more than 2 billion people worldwide. It has plagued humanity since prehistoric times, but it has become a pandemic, especially with the widespread use of sugar. It's a 5-stage process: demineralization, enamel decay, dentin decay, pulp damage, and abscess. The earlier it's detected, the easier it is to treat. Treatment methods: fluoride, filling, root canal treatment, crown, tooth extraction. But the best treatment is prevention. Temporary home remedies: salt water, cold compresses, clove oil. But these are only until you can see the dentist. Prevention: regular brushing, flossing, avoiding sugar, and twice-yearly dental checkups. Remember, tooth decay affects not only your oral health but also your heart, lungs, and even your baby's health. So take it seriously. One final reminder: don't be afraid of your dentist. Modern dentistry isn't as painful and scary as it once was. Thanks to local anesthesia, you feel nothing. Delaying treatment out of fear only makes the problem worse. And yes, dental treatments can be expensive. But the cost of an untreated cavity is much higher: pain, infection, lost work days, and even systemic diseases. It's worth the investment. I hope this video was helpful. Take care of your dental health and don't skip your regular checkups. Because healthy teeth are the foundation of a healthy life. I'm Dr. Selena, and I wish you good health. See you in the next video. And remember, brush twice a day, see your dentist twice a year, and avoid sugar. These 3 simple rules can keep your teeth healthy for life. See you. Tooth.